Oral Cancer Screening Examination for Physicians. This instructional video is prepared by Astha Oncology Associates in association with HCG Cancer Center Ahmedabad, Ahmedabad Family Physician Association and Ahmedabad Cancer Foundation. The objective of this video is to provide a clinical manual to assist providers in its early clinical diagnosis of oral precancers and preclinical invasive oral cancers, leading to prompt referral for appropriate care. Necessary prerequisites. You need to have comfortable examination room for you as well as patient. Good lighting is essential. Few but proper instruments are required like torch or light source, examination gloves, metal or wooden spatulas. Before embarking on examination, patient should be given a proper explanation of the procedure. Following certain algorithm will ensure that none of the subsites are left without examination. Systematic examination of lip, buccal mucosa, tongue, floor of mouth, palate, tonsil and posterior pharyngeal wall is required for intraoral examination in form of inspection and palpation. Neck should be examined for nodal status at various levels. Examine the outer side of the lip, upper inner mucosa and alveolus, lower inner mucosa and alveolus of the lip, followed by, with spatula, right buccal mucosa in systemic manner, retromolar trigone, upper BA sulcus, mid buccal mucosa, lower buccal sulcus and anterior buccal mucosa. Similarly, on the left side, looking at the alveolar mucosa also. Followed by examination of the dorsal surface of the tongue. Also examine the right and left lateral border of the tongue, followed by ventral surface of the tongue and mucosa of floor mouth. With the help of spatula, examine hard palate, uvula and soft palate, and right and left tonsils. Palpate the floor of mouth with finger and bimanually, also buccal mucosa and part of tongue. This should be followed by neck in systemic manner, level wise level 1A, level 1B, level 2, level 3 and level 4. Palpate the neck between thumb and your fingers for nodal swellings. Go to the level 6, especially the suprasternal notch area. Similarly, the neck can be palpated from behind in a systemic manner. Look for the thyroid, asking the patient to swallow. Examine from below upwards level 4, 3, 2 and level 1. Also palpate level 5 and occipital region. While examining oral cavity, following various conditions should be looked for. They are submucous fibrosis, leukoplakia, erythroplakia, malignant lesions, and some other pre-malignant lesions. Submucous fibrosis, also known as SMF or OSMF, is condition resulting from juxtaepithelial inflammatory disease process in the oral mucosa. Clinically, it varies from lusterless marble-like blanching of the oral mucosa to vertical and circular fibrous bands in the buccal mucosa and around pericommissural area to difficulty in mouth opening, as known as trismus, sinking of the cheeks out of proportion to age, stiff and small, deep epilated tongue, blanched floor of mouth, fibrotic gingival tissue, stiff soft palate, with reduced mobility, shrunken bud-like uvula, blanched and atrophic tonsils. More than one-fourth of affected person may have coexisting leukoplakia. It is an irreversible condition. Rate of malignant transformation can be up to 13%. Leukoplakia is predominantly white lesion of the oral mucosa that cannot be characterized as any other definable lesion. It can be association with SMF. It can be asymptomatic or mildly symptomatic in form of burning pain to spices. It can be associated with fungal infection. Up to 17.5% of them can have malignant transformation. Erythroplakia is a fiery red patch that cannot be characterized either clinically or pathologically as any other definable lesion. It has the highest risk of malignant transformation compared to all other mucosal lesions, that is up to 51%. More than 40% of these lesions harbor in situ cancer. This is nodular leukoplakia with malignant transformation. Note the nodular leukoplakia in periphery with erythroplakia in between and central granular area. Histopathological examination of the granular area was suggestive of well-differentiated squamous cell carcinoma. You can also come across frankly malignant lesions like this lesion on right buccal mucosa and this one on left margin of tongue. Physicians are advised to keep all tobacco chewers under close surveillance, especially those with pre-malignant lesions. In case of doubt, need for confirmation and diagnosis and treatment, please refer the patient for expert care of specialist.